Well, COVID-19 in South Africa has sparked a new concern, a new debate about why so many doctors are still waiting to be placed when there are shortages of staff and some hospitals in Gauteng are turning people away. The South African Medical Association Trade Union spokesperson, Dr. Nkateko Mnisi, joins me now. Doctor, thank you very much. So the reporting this week suggests that there are actually nearly 300 medical interns who graduated this year and they haven't been placed. So these are doctors who could possibly help, who are sitting at home. Is the Department of Health dragging its feet here, or does this take some time? And then, of course, there's the issue of funding as well.
Thank you for having me here today, firstly. And as you've well mentioned, I'm here not on behalf of myself personally, but of the South African Medical Association Trade Union. So indeed, there are approximately 300 unemployed doctors from all corners of South Africa, not only those waiting for internship posts, but also those that are waiting for community service and those that are already independent practitioners. This is a cohort that involves not only South African trained doctors, but also South African doctors trained in Cuba as well. So this happens every year, but this year in particular, it's a lot worse. The numbers are very high.
Yeah.
And it really is a problem because on multiple levels. Firstly, currently we're within this pandemic where we need as many hands on deck because we are understaffed currently, also with an increased strain on the healthcare system. The more hands we have assisting us, that would absolutely be wonderful in order to improve the quality of healthcare and also prevent burnout. As a trade union,
Doctor, I understand the interns. If we talk about the interns, they qualified, I think, in April or May, is that correct? So how long does it usually take? Because we're now in June, so it is a while, but maybe this process takes time. They have to be given placements across the country, looking at shortages, looking at the amount of doctors. How long does it take, or has it taken in previous years?
Okay, so I'd like to just say it's the government that controls that particular system known as the ICSP system, which is the intern community service placements. So government is in charge not only of interns, but also community service doctors, their placements. So currently the way the system is working is on a biannual system. So there's the intake that happens in January, which allows people space from January until March to enter the system. And there's the later system, which is the now system, where you should be starting in July. However, we have expressed our concerns according to this system and saying that we need to improve it better for intake to happen more often within a year, because it's not fair or in a current health system, which is under-resourced and understaffed, to have doctors that are waiting for more than 3 months to be unemployed, especially those that are interns and community service doctors, which require to be put into the system as they are not yet independent practitioners. We have currently written a letter to the acting minister, giving the acting minister a deadline until the 30th of this month to deal with this particular issue. Failure to do so will then result in us reaching or seeking other avenues to ensure that all these doctors are absorbed into our current system.
Yeah, and are you raising the funding issue as well? I understand the health department has said, look, there has to be funding for these doctors. However, talking about the Cubans, I think I worked out at one point that the Cuban doctors, each one that came in, because they are being housed and things like that, even if they're not earning that much, are costing South Africa, I think, about 200,000 Rand per year, each one.
I can't confirm the exact number or amount that it costs. It does cost money, obviously, to have doctors within the system. But when we're looking at quality healthcare, which
No, doctor, I'm talking about the Cuban doctors. So are you concerned that South Africa has justified bringing in Cuban doctors at some expense? Yeah.
Yes, I'm well aware of what you are stating. I was just explaining that I'm not sure exactly of the costs, but what is important is the quality of healthcare here in South Africa. And we need to ensure that our doctors are employed and working in our system, which is what we are fighting for currently this moment as the South African Medical Association Trade Union. The quality healthcare services of our communities and our country as a whole is what we hold dear to us and what we're fighting for.
Yeah.
And this is also,
Are these
So as
interns, we are hearing reports that there are facilities in Gauteng that are not being staffed. There are not enough doctors and nurses, even though there are these facilities and there are beds. Would these interns be able to be very effective when it comes to the fight against COVID-19? Obviously, they're just getting onto the field, but do they have the qualifications to do that?
So it's not only in Gauteng that we're understaffed, it's throughout the country. However, I do understand your concern as the third wave is at the peak or at the pinnacle in Gauteng currently. Yes, medical interns are able to assist us, just that they're unable to work without relevant supervision. However, there are supervisions in different facilities all out South Africa and in turn accredited institutions thereof, of which their hands would currently be needed to assist us in this particular manner.
All right. Thank you for this explanation. And so you've given the department a deadline. We'll follow the outcome.
Yes.
South African Medical Association Trade Union spokesperson, Dr. Nkateko Mnisi.